So I spent several years working in long-term care facilities in administrative roles. And then about 10 years ago or so, moved here to Topeka and was appointed the Secretary for the Department for Aging and Disability Services. Had a wonderful time there, learning about many different things and programs and senior services around the state and working with many different partners. The transition, I think, has gone well. I was able to spend a couple of months working with Karen and working through a transition with her and getting to know our staff and our programs and all the different things that we do here at the organization. So I was very grateful for that time of overlap that I was able to spend with her, partly because she's been here for so long and I was able to gain from her wisdom. So we want to continue to be a quality provider of senior services in the area that we serve, number one. Number two, we're looking at how we can staff up. We have a lot of openings that we need to fill so we can grow and provide more care and services to people that need it in order to stay home. And then we also are looking where we can grow into new markets. So we currently provide many of our programs in a 21 county service area in Northeast Kansas, and we're looking to see how we can grow in some of those areas, particularly east over into the Kansas City area. We are in the process of going through a $4.5 million renovation to our hospice house, our inpatient hospice facility here on our campus in Topeka. So we are thinking through and looking at how we can raise funds through a capital campaign for that project and that renovation. We'll likely be sharing more information later this year on that. So that would be one thing. And then we also have a number of special events throughout the year that have been, of course, significantly impacted by COVID with the restrictions on in-person events. So we are thinking through what, as an example, the celebration walk will look like in 2021 and whether we will be able to do that in person this year, later this summer or fall, if things are closer to normal by then. So we're going through that evaluation process now. So PACE stands for the Program of All-Inclusive Care for the Elderly, or PACE for short. And within the last few years, Midland Care has expanded where we offer PACE and now offer it in Emporia, Lawrence, and Kansas City, and are really focusing on how we can grow in all of our areas in PACE. So we actually are participating in a national grant or collaborative that helps us to learn how to better grow and increase enrollment into the program. So we are currently working on that. And then we're also working with the state of Kansas and with state agencies on how we can also grow the PACE program to make it a more robust and viable alternative to nursing homes. So